COVID-19 began in 2019 December and now hitting again and creating havoc. Now it's mainly territory in the China, and news coming that the 37 million people a day are infected with the coronavirus in China. The surge in China led by mainly the subvariant of Omicron named as a BF7. So we will see the what is the BF7 and its symptoms and precaution. BF7 variant is a very dangerous variation. It has the following features. It has a short incubation rate. So this is the first point. Second is it infect the vaccinated individual. It has a capability to resistant to antibodies created by vaccination. So this evade the immunity given by the vaccination, and this is the very serious cause of concern, and mainly because of this it is a word in concern that it may affect the vaccinated people also. Another thing is that it is have the high transmission rate. It transmit very fast, and also it is a very infectious. According to the medical professional, it has a transmission infection rate, means R0 value is very high, is more than 10. It can infect the more than 10 people from the one single person. So this is the very concerning news for the BF7 variant. Let's see what are the symptoms. Symptoms first include the upper respiratory infection. This is the very common in the every COVID cases, that your respiratory system up to the lungs get infected, and this may cause the pneumonia. The severe pneumonia is also responsible for the fatal death. Because of this, it also have the symptoms like the sore throat. It is the initial symptoms, and if you have the sore throat you should consult your doctor first. Then the runny nose is also other symptoms, that common cold symptoms are present in this BF7 variant. Cough is also natural to come in this COVID-19 situation created by BF7. And the fever, mild to severe fever, is also noticed in the patient of the COVID-19. There are the many people, they have also asymptomatic, and they may not witness the any symptoms of the given, but they have poses the threat to that they can infect the other people. And the majority of the people at risk are like the older people who crosses the 50 or 60 year of age, and people have the other diseases like comorbidity, like heart diseases, sugars, diabetes. They are at the criticality, they are at the danger, main danger for them to get infected. So what are the precaution against this? Main precaution is that you should follow the pro COVID protocols. First is the mask up. Use the mask at the public and the crowded places, and wherever you have the chance to get infected, you should wear the mask. Then another thing is good hygiene. Bath daily, have the proper hygiene, wash your hand again and again with sanitizer. Then you should be vaccinated. Vaccine is a very much good medicine and essential medicine for the coronavirus. So be vaccinated, give the 2 doses. If you are eligible, then get a booster dose too. Then maintain the good environment. As you know that coronavirus lives in the closed places more longer than the ventilated places. So keep your houses ventilated, allow air to pass, go and outside, inside. Next the thing is that keep the social distancing. It is a far most important. Always have the safe distance from the other people, because he may or she may have the coronavirus. So this is the precaution for the coronavirus. Also follow the doctor's advice. If you have the any symptoms, then visit your family doctor, get expert advice, get your tested at regularly. And if you have the symptoms or your test result is not came till that time, you must be have the separation room in your house or your wherever you live. So the because of this China virus, there are the also people are around the globe is concerning. And this subvariant already found in the several countries like France, Belgium, USA, Denmark, UK, and Germany. It is sublineage of the Omicron variant BA5, and it is a transmissible. According to the one study, a journal called as the Cell Host and Microbe, BF7 variant has a fourfold higher neutralization resistance than the original coronavirus, which was generated in the Wuhan, China. This means that antibodies from vaccination are not that much effective against this virus. So this is everything happening, and the Christmas and New Year are around the corner. People are going outside for the shopping and celebrating, meeting the people. So it has a chances that this kind of celebration may have the adverse impact on the COVID-19 rise, and it may affect the people life as whole. So be careful, use appropriate behavior, and take care of yourself and your loved ones. Thank you.